A lot of fantastic updates. The first of all was, as I mentioned, what is called as the real world evidence. There is one product called Yescarta, which has been out for about 2 years now. We noticed in patients who have more than 500 patients or were treated countrywide in 50 plus institutions who had been monitored by CIBMTR, or Center for Bone Marrow and Transplant in Wisconsin. And what they noticed is this therapy is very efficacious, first of all. So that was the most important part, because sometimes you see that in clinical trials and that doesn't really replicate in real world. So I think that was number one. The number two, we also saw that toxicity or side effect profile was very similar to what we saw in the clinical trial. So that was second thing. And I think the third thing we learned as a clinical experience was that these, the use of medications to prevent or to treat cytokine release or these toxicities was more than what we have seen in clinical trials. So medications like steroids and tocilizumab, which is a common medication to treat these cytokine release syndrome, was used a lot more in real world setting than it was used in clinical trials.